In the left upper quadrant, what we're interested in is what we call the perisplenic view often, and we're not so interested in the kidney on this side because there's not a potential space between the kidney and the spleen like on the right, like there is between the kidney and the liver. Where we're trying to look is at the lower tip of the spleen here and looking for a little cap of fluid around there, and then we're looking for the space between the diaphragm and the spleen here. And the key to getting a good image of the spleen is to go in the posterior axillary line and a little bit higher than when you're looking at Morrison's pouch. So more like maybe the 6th to 10th intercostal space, and make sure your hand is right back against the bed so you're pretty far posterior. The other thing we're looking for in this view is we're looking at the diaphragm on the left side here, and we're trying to look above or to the left of the diaphragm for, again, that mirror artifact, which assures us that we don't have a pleural effusion or hemothorax on the left. This is an example of free fluid in the left upper quadrant around the spleen. So one of the places we often see free fluid around the spleen is around the lower tip of the spleen here. You can see a black cap of fluid around that lower tip there. And the other place is below the diaphragm here, which is not present in this patient. But in this next image you can see this is the spleen here, the diaphragm's up here, and you can see a large amount of fluid separating the diaphragm and the spleen. And remember, we don't really care much about the kidney because there isn't a potential space between the kidney and the spleen. So around the lower tip and above the spleen is where we look. The other thing we look at in the left upper quadrant is above the spleen and the diaphragm in the chest. So this is the spleen here, the diaphragm is here, and then to the left of that, or above it, up in the chest, we see a black fluid collection here, and as the patient breathes, we see the left lower lobe of the lung floating in that fluid.